Hey guys, we've been getting a ton of inquiries on social media regarding the liquid nose jobs that Dr. Roher has been doing and the amazing results that he's been getting. One of the biggest concerns and the major question you guys have had is regarding blindness, and can this occur for you? So, Dr. Roher, would you like to weigh in on that? Can you experience blindness with liquid nose jobs, and how safe is it?
Yeah, so glad you asked that question, and I've been reading the comments on social as well, and I've seen that one probably more than any other comment or question. So I'm happy to address it. First, I'd like to say that this is a technically challenging procedure, and there are risks to it, just like any medical procedure. Maybe a little more so with the liquid nose job. So I want to emphasize how important it is that you go to an experienced provider that does high volume and is able to handle any of the complications that may arise, including blindness. So to start out, we just wanted to show you guys this National Library of Medicine, and it's talking about the likelihood of visual impairment, like of going blind as a result of a liquid nose job or any other filler. And things are categorized as common, occasional, infrequent, rare, and very rare. And blindness as a result of filler is categorized as very rare. Still, you're going in for a cosmetic procedure, and I would hate to see a major complication as a result. So, a little anatomy lesson and a little history and discuss filler itself. Filler is a thick, viscous substance. And so it's like a gel. Botox is water, it's like the consistency of water. So it goes in, if it gets into a vessel, nothing happens. But if you inject a thick, viscous substance into an artery, you could block or occlude that artery. There are certain anatomical portions of the face that are more concerning, just the anatomy of someone's face, the way their facial arteries work. One, for example, is right here in the forehead. That's why a lot of times we do not inject filler when someone has a very deep line between their eyebrows, because you could inject into something called the supratrochlear artery, and there's a watershed area, meaning the forehead is only fed by that one artery, so there's no collateral blood flow. And so by occluding the artery here, you can cause skin breakdown, even necrosis in the forehead here. So I've done hundreds, if not thousands, of liquid nose jobs, and I have not seen a true embolization, meaning the filler goes from one of the arteries in the nose to the artery that feeds the back of the eyeball, the retinal artery, the one that you need in order to see. It's super important that, one, you go to someone with the technique that's very unlikely to happen, as well as the expertise to handle it should this unlikely event does occur. Long answer, but basically, to sum up, it's very unlikely, but you want to go to the best provider to handle it should something wild like that occur. Thank you.